Other health impairments is a broad category of disabilities found in today's schools among children, teenagers, and young adults. Having an other health impairment means having limited strength, vitality, or alertness to environmental stimuli that results in limited alertness with respect to the educational environment that is due to chronic or acute health problems such as attention deficit disorder or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome, and adversely affects a child's educational performance. The most common of the other health impairments, or OHI, is attention deficit hyperactivity disorder, or ADHD. ADHD is a brain disorder marked by inattention and/or hyperactivity impulsivity that interferes with functioning or development. The 5 main disabilities categorized in other health impairments are ADHD, diabetes, epilepsy, Tourette syndrome, and asthma. Diabetes is a disease that affects how one's body uses blood sugar, called glucose. Diabetes is characterized by extreme thirst and hunger, blurred vision, frequent urination, and sudden or unexplained weight loss. Epilepsy is a disorder of the central nervous system characterized by nerve cell activity in the brain becoming disrupted, causing seizures. Other symptoms of epilepsy include twitching of the arms and legs, sudden confusion, and loss of consciousness. Tourette syndrome is a disorder that involves tics, which are sudden repetitive movements or sounds that cannot be controlled. Tics are categorized as being either simple or complex. Examples of tics are eye blinking, facial twitching, head jerking, shrugging, inappropriate gesturing, grunting, coughing, hopping, and swearing. Asthma is a condition characterized by the swelling or narrowing of the airways and the overproduction of mucus. Common asthma symptoms include wheezing, coughing, shortness of breath, and tightness in the chest. Although other health impairments is a large category, most of the disabilities included in this category have a low incidence rate. However, ADHD is in this category of disabilities and it has a high incidence rate. Approximately 9.5% of students ages 4 to 17 are diagnosed with ADHD each year, but those numbers are rising. Of the children diagnosed with ADHD, 2.7% are ages 4 to 5, 9.5% are ages 6 to 11, and 11.8% are ages 12 to 17. Also, of the children diagnosed with ADHD, 13.3% are boys and 5.6% are girls. There are 3 primary warning signs associated with ADHD: hyperactivity, impulsivity, and inattention. Hyperactivity involves fidgeting, difficulty waiting, talking excessively, and interrupting. Impulsivity involves being unable to focus on relevant tasks, being disruptive to the class, and acting as if driven by a motor. Inattention involves having difficulty giving close attention to details, having trouble listening, being easily distracted, being forgetful, and having poor organization skills. Despite all these symptoms, there are numerous teaching strategies, tips, and instructional techniques that teachers can use to help their students with ADHD. One strategy teachers can use is providing structure and organization to the everyday classroom routine. Teachers can start off by writing today's agenda on the board and by making a space on the board to write down upcoming assignments and due dates for that class. Another useful tip for Teachers is teaching content clearly and directly. This will make it easier for all students to succeed, not just students with ADHD. This can be done by using a good amount of visuals in lessons. Teachers can also hold high expectations for all students. This will make students with ADHD feel like everyone is in the same boat. As a teacher, it is important to encourage appropriate academic performance and appropriate social performance among all students, but especially those with ADHD. Another tip for teachers who have students with ADHD is to seat them away from the door and any windows in the classroom. It is also beneficial for teachers to create a quiet, secluded environment where students with ADHD can take tests and/or even read. One small thing a teacher can do is to make eye contact with students with ADHD when lecturing. One last technique teachers can use is giving partial credit for partially completed work and accepting late work. It is up to the teacher if they want to do this only for their students with ADHD or if they want to extend this rule out to every student. There are 5 main things that teachers need to know about ADHD. First, ADHD is not just kids being kids. It's a real disorder. Second, medication can be used to reduce symptoms of ADHD, but it is not a cure. Thirdly, kids with ADHD are eligible for IEPs and 504s. Fourth, students with ADHD cannot learn like everyone else. Learning requires extra time, patience, and effort. Finally, it is important for teachers to know that ADHD affects all parts of a kid's life, not just school.